Welcome to the MS&Me Radio Network, a division of the Multiple Sclerosis Global Support Network. The following program broadcast is an original creation by the broadcast entity. Discussion within the following broadcast should be used for informational purposes only and is not a substitute for professional medical advice or consultation. Before considering application of any broadcast content in the following program, please consult your healthcare provider. If you feel you are having a medical emergency, please contact your local health services for immediate assistance. MS&Me Media and the Multiple Sclerosis Global Support Network do not guarantee or warrant the accuracy of information in the broadcast to follow. The Multiple Sclerosis Global Support Network provisions broadcast services to program hosts. Information discussed in the broadcast does not necessarily reflect the views, opinions, or goals of the network and are solely those of the show broadcast host. Should you wish to host a broadcast, please visit our website at msmemedia.com and submit a request to become a program host. We thank you for listening to the MS&Me Radio Network. Enjoy the show.
Hey everyone, it's Kate Milliken. I am the host of Healing Through the Story of You. We are a show that aims to have honest conversations, hear real testimonials, and share vulnerable moments, all with the hope of giving perspective and encouraging every single one of you guys to believe that you can not only make yourself feel better, but become better in terms of opening up your spectrum, connecting with others, and potentially gaining purpose by helping each other through what you've been through with MS and beyond. So this week, I'm super excited to share one of my favorite webcasts with Mount Sinai neurologist Dr. Krieger. In the effort to be transparent, Dr. Krieger is actually my neurologist, and I love him. And in our time together, we have had a lot of conversations outside of the MS itself, really talking philosophically about healing and bedside manner and interactions between doctors and patients. And it's just been wonderful. And I really quickly want to share one story that I think demonstrates this. And that is that when I was diagnosed in 2006, I had an enormous lesion on my C4 vertebrae. And I spent the first year with my MS really working to try to make myself feel better, ranging from getting right on Copaxone to a supplemental regimen prescribed by an osteopath to getting my mercury fillings removed. I changed my diet. I really worked hard to improve, and I'm a video producer by trade, and I just decided to document my story of my first year with MS. So I started kind of 2 weeks after my diagnosis, where I was terrified, and I ended the moment I came back from my first year MRI to see how my MS was. And it turns out in that appointment, my C4 lesion had actually reversed itself. It was really no longer visible on the MRI. And I have some incredible footage of Dr. Krieger coming into the room to let me know of this news. And it was a very emotional moment for me. I also have the moment recorded when I got to tell my family that the lesion had reversed itself and that I was in a much better place with my MS. And my father got up from the table crying and hugging. My mother was just so palpably just relieved and joyous, and it was a very powerful moment. And Dr. Krieger saw that footage, and as a result of watching a real person with MS interact with their family and understanding the type of impact any type of hopeful news can bring, Dr. Krieger has changed his behavior on how he tells his patients certain pieces of information. So in the past, if one of his patients has had a stable MRI, he would just say, I know your MRI is stable and come back in 6 months, yada, yada, no big deal. And now when a patient has a stable MRI, he comes into the room and he shuts the door and he looks at the patient and he says, your MRI is stable. Well done. Now, is there anything scientific or clinical to prove any correlation of any of us having control on our MS? Not really, but it then puts us into this wonderful kind of interim ground of how much does attitude and belief and philosophy really affect how you do and how you feel. So I just want to tell that story for you guys to think about it. and segue into the conversation I had with Dr. Krieger about probably one of the biggest elements of our MS journey that we all deal with, which is the fear of the unknown. Enjoy. Hi, everybody. It's Kate Milliken, the founder of My Counterpain for My Counterpain One-on-One. And today I am here with Dr. Dr. Krieger, who is a neurologist and specialist at the Corinne Goldsmith Dickinson Center for MS at Mount Sinai, New York City. I am thrilled to also admit to the world that Dr. Krieger is my neurologist. He was with me when I was diagnosed. He's been with me for over a decade. And I was especially thrilled to take on this subject that we're going to talk about today with him because I lived the experience with him, and that is new diagnoses and the fear of the unknown. So Dr. Krieger, I'm just going to jump right in. You have now been a neurologist for over a decade, and you have seen patient after patient get diagnosed. What is it like from your perspective when patients get word that they have been diagnosed with MS?
Well, I think number one, people respond very differently to difficult news, and I think getting an MS diagnosis is never easy for anybody. It's probably the only thing that everyone has in common is that it's difficult news for anybody who receives it. Now, because I work at a multiple sclerosis center and it says Corinne Goldsmith Dickinson Center for Multiple Sclerosis on the door, it's not a huge surprise for someone when we first have that conversation because they're in our center for that reason. So it is often not the very first time that they've ever heard it or ever thought about it when they come to me, but something about coming to an MS center and sitting down with a neurologist and hearing those words, I think makes it real, and new for everybody that gets newly diagnosed. So I think that's hard for people, no question.
Go ahead.
No, I was going to say people approach it very, very differently. It's, I think for some people, they believe it immediately. It's a validation in some ways of the fact that they don't feel right and they want to know what's wrong, and they've long believed that something's not wrong, and now there's a name for it and a diagnosis and full speed ahead. And I think for other people, particularly those who feel well, getting a diagnosis like multiple sclerosis makes no sense to them at all. And they reject it out of hand because how could it be that they have this diagnosis? And so I think it really ranges from immediate acceptance to complete rejection and everything in between.
I feel like in the world of MS too that, more and more I think MS has become more common, but certainly I think there's a feeling of not really understanding what it is in the first place. So kind of getting a grasp on that. And one thing I would say, certainly probably its shining characteristic is that MS is individual for everybody. How do you try to convey that to patients and caregivers?
Well, you pose this as the fear of the unknown, and I think the unknown and the variability go hand in hand here. I think the unknown and the unpredictability go hand in hand. And there are still things that we struggle to predict and struggle to be able to tell someone, in a definitive way. And I think that can be very unsettling for people. In some ways, the unknown, or not having a certainty of prognosis or a certainty of what the experience of having MS will be like, in some ways that unknown is the worst part about this diagnosis. Worse in some ways than more traditional bad news. More traditional news of you've got a bad diagnosis and something bad is going to happen. This is different. This is a difficult diagnosis to hear and to receive, but it doesn't necessarily mean a bad prognosis for everybody. And the goal is for it not to be a bad prognosis for people. And I think that uncertainty is very, very challenging to convey and challenging to hear.
I think about the fact that for people that come in with a diagnosis, they often present with symptoms. And in some way, when you're in the moment experiencing the symptoms, you can really get a grasp of them. I have to believe there are a lot of people that come through the door. I certainly was one of trying to quantify it, trying to put it in some sort of framework. Is there anything you can talk about in that regard?
Well, some people will say, and I don't know if there's really data to back this up, but some people will say that even an unremittingly terrible diagnosis like ALS, Lou Gehrig's disease, which basically only goes one way, that people are less depressed with that diagnosis than with MS.
Wow.
Now, I don't know if there's 100% data to support that conjecture, but that really speaks to the fact that the uncertainty of the disease can be as overwhelming as the certainty of something bad. And I think that's psychologically very important. And I try to remember that if I'm going to tell someone, this is a very variable condition, you have a good chance to do well, they might still walk away from it more depressed and more upset by that uncertainty than if I'd said there's no chance of doing well.
Yeah. Which,
as a clinician, I have to remember that. I have to stay aware of that, because I might think I'm giving someone good news by saying,
right,
prognosis is uncertain and we can do things, but it needs to be put to the positive. To your question about quantifying it, it's hard. And part of that is we like to quantify things. Part of it too is that, we've all grown up watching medical TV in one way or another, be it ER or whatever. And, the way doctors are always portrayed is giving people numbers. You've got a 5% chance of this, or 10 days this will happen, or you've got 3 months to live. The fact is, we never say things like that, really.
Right.
Because it's almost impossible to be right.
In anything, right? I mean, you always, you never have a certain knowledge that everybody's going to act one way.
Right. Right. And so I think people are sort of bred to expect the doctor puts on the white coat and says things in a very definitive, quantified way. And yet I try not to do that because I'm likely to be wrong. And even in MS in particular, when we talk about the rationale for treatment and our disease modifying therapies, what they're doing is reducing the risk of things. And we know that based on clinical trials and data, thousands of people followed for dozens of years. But it's hard to just give that to one person and say, your risk is reduced by X%.
Right.
I can't do that for the individual person, but I do want her to understand what that data means, where it comes from, and how we can use that to make good decisions and give someone their best possible chance of doing well.
Talk about, for you, as you go through this incredibly poignant conversation with the patient and the caregiver, how much you are working with a philosophy of listening to people react with, let's say, fear, sadness, and a half empty perspective versus you personally thinking half full. How do you work with that?
And me personally, I try to be as half full as possible with my patients, but I'm on a personal level. I mean, I'm not always a half full kind of person. I think anybody who's universally, blindly optimistic, I think, lacks a certain nuance. So I try to come at it, sensitive to pessimism and bring some optimism to that. I think
because it's real and it's serious.
It is. And if you're facing uncertainty, I think it brings out someone's underlying personality structure. I think people come into the room having lived an adult life or a young adult life. They are who they are. And I think facing something challenging just brings out someone's underlying personality. Someone who approaches everything with, I'm going to hit this as hard as I can and be relentlessly positive and broadcast it to the world. That's a certain person.
Yeah.
That's who you were walking into the room, a decade ago. Not everybody is like that. Not everybody can be like that. And so, I try to take things that I've learned from people like you, and how can we take that and try and apply a little bit of that thinking to someone for whom that kind of relentless optimism doesn't come as naturally. How can you do that and make that a good fit for someone? So I try to talk about uncertainty and the range of possible outcomes as a positive.
Do you
here's what we don't know, here's what we can do.
Do you feel that, so far in terms of my MS, I've been doing so well and not had a significant relapse for a number of years. Talk to me about the spirit you find for people who are much more progressed in terms of positive attitude, and how you see that making an impact in their lives, even if they are debilitated.
I think that people imagine that they will feel worse about things that could occur than they actually will. This is sort of it's a deep concept in a sense. It's something that in the sort of behavioral literature and in the philosophy literature is called affective forecasting.
Okay.
How we think we're going to feel if certain things happen. So someone might say to me, newly diagnosed, that if she's ever in a wheelchair, her life is over. That's it. And I can never respond, no, you won't feel that way. One can never say that, one can never know that about someone else, but I'll tell you, I take care of a lot of people who have real significant physical disability. They use walkers, they use wheelchairs, they use scooters, and their lives are not over. They don't think of their lives as being over. They have adapted, they have adjusted, they've persevered. Obviously, things have not gone the way I want it to as their neurologist necessarily, or I may have taken over their care 20 or 30 years into this disease, but I have a lot of people who use scooters and crutches and walkers who live incredibly full and dynamic lives, who are contributing, who are working or retired or traveling, whatever they're doing. And I'm sure that they felt the same way 40 years earlier. If they ever needed a wheelchair, it would all be over, and that turned out not to be the case. And so I try to respect that, I try to foster that, and allow people to adapt to their physical abilities, adapt to their capabilities, and make the most of it, and yet not be sort of full of platitudes, along the way. I think you have to be honest and genuine with someone.
I love that. And I feel, if we're going to kind of get philosophical, I feel that when you start the MS journey and you get the diagnosis, all you see is a linear progression to doom, right? And I have felt through my own experience that as you start living and accepting and managing and getting perspective, all of a sudden, in some ways, the journey kind of starts getting vertical. Can you comment on that?
I think that people imagine their lives as sort of a linear path in everything, we're in our careers or in our relationships, or, we're going to hit certain milestones at certain points in time. I think the truth is that for all of us, disease or no disease, MS or not, I think that life takes more turns than we anticipate. And when we look back, our life has taken more turns than we might even realize to get us to where we are.
Right.
And I think that part of adapting to the unknown or the uncertainties of an MS diagnosis is an intrinsic ability to be flexible, be responsive, be able to adapt and respond when things get thrown in the way that you didn't anticipate. And what I try to do as the doctor, since my piece of it in some ways is small, but what I try to do as the doctor is frame it as there's uncertainty, but we know what we're going to do if certain things happen. If a relapse happens, we know how we'll treat it. If an MRI scan changes, we know what other options we have for treatment. If symptoms emerge, fatigue, pain, whatever they may be, there are things that we can do about those things, so that when the unexpected occurs, there's a plan in place, or at least a sensibility that there will be a plan in place. I think that's how I try to counteract the uncertainty with the response team, myself and the people here at our center, my patient and their family and their friends and their support team, so that it's not one person facing uncertainty alone, but a team of people and a response plan in place, whatever may occur.
I almost feel like that's kind of like putting a foothold into something that's abstract, that you have like a concrete thing to kind of base your thoughts around. Are there any other footholds that you have found over time that have been helpful in terms of things you say to your patients and also your caregivers, by the way? I mean, I don't know if you feel like you're talking to them differently in the same meeting or not, but what are some things that you have found have been helpful to those people?
Well, I mean, I do talk to care providers and family members and whoever someone brings with them. When we're in the waiting room and someone says, "Can my mom come or can my husband come?" And like, of course.
Yeah.
Could you imagine if I said, no, they must wait outside?
I know. And I'm locking the door.
Right. You want them in the room. You want them in the room. You want them in the discussion. And I think, they are an important foothold physically, and then also to help to reinforce the kinds of things that I'm trying to allow someone to understand. Because again, I get a few minutes with someone to say these things, and I think they bear repeating, and people need to hear them over and over again. So yeah, I think there's people as footholds. I think there are milestones that I try to look to for someone. Their first 1 year scan, I want it to be stable. If it's not stable, I want them to know what the plan's going to be to respond to that. I want someone to be well without new symptoms for 5 years. That's a big milestone for someone to say, look, I've been doing this for 5 years, and here's how I'm doing, here's how well I'm doing, or here's what the challenges have been. I want people to look at the milestones in our field. How about that? It's footholds not just in someone's life, but in the field of MS and MS research and treatment. I've come to saying to people now, someone's newly diagnosed with MS, and she says, what am I going to be able to do in 10 years? Am I going to be impaired in 10 years in some way? I'll talk about that, but then I'll also say, look, it's not just what you can do in 10 years. What are we going to be able to do in 10 years?
That's awesome.
That we can't do now. And I try to make sure that people understand that it's not just the condition that might be dynamic. It's our field that's dynamic, and we change along with it.
I would say as we finish up here, when you and I were together and I was first diagnosed, you were a fellow. And as a result of you being a fellow, I had the opportunity to book a 45-minute appointment, even though I had been diagnosed, even though I was on a therapy, just to talk about the fear of the unknown. And for me, what I remember is recognizing that the unknown is so abstract, and really getting to talk very concretely about the abstract. And what I was left with was a feeling of perspective about it that I feel like set the course of my healing. So I would love for you just to close with talking about the importance of perspective in this moment as people kind of progress with their MS journey, and your best advice for someone watching this today.
Well, I think this whole conversation today has been about this perspective too, and the idea of spending a lot of time talking about these things with people is something that's important to me as a doctor. It has not been important to the way healthcare has moved in the last 10 years, so it's harder and harder for us to have that protected time, in a sense, to talk through these things.
Right.
But I still try to preserve it as much as we can. I think one thing that we talk about a lot, and you've talked about a lot, is the fact that MS is a community, and there's a community of people who are there to share their information and resources. This is a community that nobody ever asks to join, and yet then someone's in it. And I think that it takes different people different amounts of time to come around to wanting that information, wanting that perspective. I think some people want to banish it first and maybe come to a growing acceptance of it in their own way. And so what I would say to anybody watching this now who's newly diagnosed, or even someone who's not, in a sense, there's always, I think, a part of it that's not real, or that one has to kind of, face anew every time you get an MRI scan done, or every
That's
time.
right, or there's some sort of progression in some domain.
Right, and I think what I would say is that, it's never going to feel perfectly under control. Waiting for it to feel perfectly under control, I think, is a setup for never feeling that way. The perspective, I think, comes from knowing that there are always going to be some degree of uncertainty around it, and being as comfortable with that as possible, and remembering too that there's uncertainty before you get a diagnosis, there's uncertainty after, and there's this sort of desire to control everything in ways that we can't. But I think if we remember how much agency we do have as clinicians to make this better, and then how much agency our our patients, people with MS, have to take good care of themselves, to be proactive.
Personal power.
Personal power, positive health-related activities and behaviors. This is not a linear path to doom, as you said. It's not a linear path, and it's not a path to doom. And I think that's the perspective that I want people to have, is that it's a variable path, and hopefully it's a path to as much success and well-being as we can achieve now and as we'll be able to achieve in the years to come.
To share a moment about your fear of the unknown or another moment in your MS journey, please visit mycounterpain.com. See you on the inside.